Welcome to Cape Media News. I'm Emily Tullock. Today, our guest is Mr. Jay Camerano, a Dorchester resident that has launched a new organization called the Massachusetts Compassionate Drug Policy Coalition. We brought him on today to find out more information about the mission and goals of the coalition. Thank you so much for joining us. How are you doing?
I'm doing great. How are you?
I am good. Thank you so much.
Okay.
So can you tell us a little bit about what this coalition is? What do you hope to accomplish with this organization?
So the mission of the Massachusetts Coalition or Compassionate Drug Policy Coalition is basically to highlight ways in which the current policies are harmful to not just the individuals who use drugs, but to the communities and state as a whole, and then to work with those communities and the state to try and find more compassionate, more healing directions to the current drug policy.
So you mentioned that you find there are harmful impacts on our current drug policies. So can you elaborate more on what parts of it that you feel are harmful and how this current policy could be more effective?
Yeah. So one example of the current policy that I think is really harmful is the fact that paraphernalia is also criminalized, because this causes a lot of what we see, a lot of the complaints that people have that don't use drugs are caused by this paraphernalia law, such as having needles on the ground and things like that. By having a paraphernalia law, the needles can't be the person can't store their needles safely and bring them to a place where they can dispose of them safely, because they're risking jail time. Another way that it's really affecting the community and people is that people aren't able to have access to recovery tools. Even the ones that already exist are limited based on if you're actually using right then. I know a guy who he was going to detox, and to get into detox you have to sit in a waiting room for 8 hours and basically wait for a bed to open up, and this can last multiple days. And he was withdrawing from heroin, so every day, to keep from withdrawing from heroin and to keep make it so that he can sit in the waiting room, he had to use small amounts of heroin every day. And if he had gotten caught while he was using that, he wouldn't have been able to go to the detox, and he wouldn't have been able to access any of those recovery resources after detox. So basically, it's causing harm to people who don't use drugs and to people who do use drugs in a very severe way. And I think that by decriminalizing drugs, that would be the huge change in policy for making a more compassionate, more useful system, because people could go to detox without worrying. They could, save their needles without worrying. And in Portugal, overdose rates were cut in half, or HIV contraction rates were cut in half when they decriminalized drugs. So it's been shown to work in a lot of different areas around the globe. And it's meeting drugs with compassion and instead of fear, which I think is very important.
Absolutely. Now, if people want to get involved with this coalition, they want to keep up to date with all that information, where's the best place for them to go for that?
So we have a Facebook, Twitter, and Instagram that are all at Mass CDPC. And we also have an email address, which is also masscdpc@gmail.com. And if you're struggling, or you know someone who is struggling and wants to change their use, there's a local Massachusetts-based organization called Harm Reduction Works, and they do meetings and resources for people who are looking for harm reduction ways, and that can include abstinence. And they support people who are trying to change their use in a really science-based way.
Mm-hmm. Well, thank you so much for joining us today and for discussing the Massachusetts Compassionate Drug Policy Coalition, and best of luck to you on your journey.
Thank you. Thank you for having me.
Absolutely. For Cape Media News, I'm Emily Tullock.